better to start distal and work up for future IVs, because if you blow a vessel high up, you may not have access to that again further down. And don't choose the antecubital fossa. Now, lots of times you will, that's where you'll see the IV. It's an easier one to get, but it's not reliable. And I've worked at facilities who have a protocol that, and very often this is what the paramedics will use in the field, because they just need to get an IV quick in, and they figure you'll deal with it when they get you into the hospital. So, but if IV is started in the field, it always requires restarting, no matter how good it is, because of the possibility in that environment of contamination. You don't want a line infection. And if the patient, bends their arm, it's very uncomfortable in that, and, the catheters, they get bent because, they're right in that spot. It's really not a very good place to put an IV. So, so start lower. Never try to put an IV in this area here. Forget that. Usually this surface is best. Sometimes you can get one in the hand, though sometimes they're small. Mine has happened to be big, but and especially as someone gets older, they can get real tiny and fragile. And you don't want your catheter size to be larger than the vessel, of course, because you're not going to have much success there, or even for it to totally fill up the vessel isn't too good an idea either, because the blood has to flow around that catheter. So usually up in here is a good idea.
If you can't really tell the size of the vessel, or at least not yet, like how would you choose a size? Would you just go with a smaller?
Yeah, usually they use like an 18 or a 20. Okay. And only if you anticipate the patient's going to need blood or whatever, do you want to go small and larger than that.
What's the ped size for you?
Ped size probably about 23, depending upon how large the kids are. So it's actually better to be able to feel the vessel than to see the vessel. So it's more reliable in terms of getting into it. So you would put your tourniquet on when you set everything up, and we'll go through that step by step, but just a couple things here. When you put your tourniquet on, you don't have to have any gloves or anything yet. And then you can have the patient, make a fist or open and close a couple of times to kind of pump up the vessels a little bit, and then you feel for a good vessel, one that you can feel. And you really want to be able to feel it with 2 fingers, because when you go for it, you know which direction it's running if you've got 2 fingers on it. If you only have the 1 finger, you're not sure, is it going heading that way or heading that way, right? And you're going to be going up. So 2 fingers is a good idea. And then when you actually go to put it in, you need to find it. Well, first of all, you find where you think is a good place to go in to do it. Then take the tourniquet back off. Of course, the patient, release their hand. Okay, so now you're going to go here. Well, you don't want to leave that tourniquet on the whole time. So release it, and then you get your antiseptic, clean up the site, make sure everything's all set to go. When you're ready to start, then you put this back on again. When you're ready to do your stick, then you go back and go in. Okay. And then as you go in, remember she put pressure on that vessel up above the catheter before she took the needle out. Because once you take the needle out, the blood's going to pour out of the vessel. So if you put a little pressure on the vessel, it'll clamp it off.
Do you
So it
take the
won't bleed.
tourniquet off also?
Oh, yes. Once you're in, actually you can even, some things say that you should release this when you're just ready to go in, you can release it. If you forget and leave it on, particularly in an elderly person with fragile vessels, you're more likely to blow the vessel. But you don't want to leave this on any longer than you have to. So anyway, you go in to your vessel. Now sometimes, depending upon how big that vessel is, I might actually leave it on, but then as soon as I'm in, I'll release it before I do anything else, really quick. So put pressure. Now when you put pressure above it, you don't want to put it on top of the catheter because you're not going to occlude the vessel if you're on top of the catheter, so you want to go above it. Okay? And everything up. Okay, so why don't we go through